Good afternoon. I'm Dr. Nicholas Farina, and I will be presenting to you today about one of our projects, Remote Memory Assessment Services, a study of patient satisfaction. I hope to be able to share some of the great work that we're doing from our end. Just want to highlight that this is a project that is led by Dr. Gosia Racek, and I'm one of the collaborators. So hopefully I'll be able to do it some justice today. So just a bit of background behind this project. As of March 23rd, 2020, what has happened is that due to COVID and the lockdown, a lot of the what was considered non-essential healthcare services were suspended. And so this included kind of routine face-to-face memory assessment services. And this meant that within West Sussex, where Gosia works, that these face-to-face services weren't going ahead. But what was being found was that actually there were a number of people that were currently in that diagnostic process, or they were waiting their first assessment. And it meant that they were unable to receive their diagnosis. And as GPs were still running in some way, shape or form, it did mean that some people were being or continued to be referred to memory assessment services from the GPs. So that meant that there was an ever-growing number of people entering the system. So obviously, one of the key challenges that we saw was that actually that there was this ever-growing backlog of people that were waiting for their first assessment and diagnosis. And this is problematic because obviously there is only a certain capacity within each service to complete this, the diagnosis. And as time was going on, it would mean that there would be an ever-growing number of people that needed to go through these services. And obviously this then has repercussions. So if people aren't receiving a diagnosis in a timely manner, then it means that they are going to experience deterioration in cognitive and general function. They may develop neuropsychiatric symptoms, and it may cause increased distress. And without a diagnosis, it means that they aren't able to access a variety of treatments that may be available to them or get this type of support that they need. And as a result, it may lead to people to enter the healthcare system in crisis through A&E, for example. And obviously, as a vulnerable group, this means that there is, this is not great to be going to A&E in time of a pandemic. But actually, we also saw that there were some opportunities because actually we do live in this digital age where we can use remote assessment platforms such as Attend Anywhere, where we will, which enables you to securely to have these consultations in a remote setting, so that there is not the need to do a face-to-face memory assessment. And similarly, there are now a range of cognitive assessment tools that don't require face-to-face assessment, and so obviously that means that something that 20 years ago may not have been possible is something that can actually be quite easily done in this day and age. And really, within our collaboration, within our team, and thanks to ARC, we could draw upon important collaborators, important clinicians within the region to understand how these remote memory assessment services are running, or if they are running within the local area. So this gives us the opportunity to not just look at a single service run by a single clinician, but allows us to look and compare across sites. So really what we are interested in is to see how these remote memory assessment services, how they've been run, how they affect patient and carer satisfaction with the service, but also to see whether these remote memory assessment services impact clinical outcomes related to dementia diagnosis. And this research is one where we're collecting data across West Sussex Memory Assessment Services, Surrey and Borders, and also SLAM. And the idea would be that 38 consecutive referrals from these memory assessment services will then be invited to participate in our research. And as kind of noted before, as part of the aims, really this, the key focus is going to be patient and carer satisfaction to ensure that they feel confident in the diagnosis that they receive, that they feel that they have the appropriate time and the ability to kind of gain as much information that they feel is important through this remote memory assessment model. But we've also got several secondary outcomes. We are interested in clinicians' diagnostic confidence, but also things such as the kind of waiting times, whether they receive treatments, whether diagnoses change over time. So really, we kind of want to get a clear picture about what happens following that diagnosis process, not just what the participants and carers' satisfaction are. So within the clinical pathway, really what we have at the moment is that people that, say, are traditionally referred to from GPs are currently awaiting to be seen at a remote memory assessment service. And so the clinicians or a member of the admin staff will then get in contact with these patients to organise the remote MAS, and at which point they'll also be invited to participate in the research. And then within a couple of weeks, depending on capacity and backlog, really these patients will then be seen at a remote MAS, where they will have screening, diagnosis, treatment plans set up. And this may occur over several, 1 or 2 sessions as well, depending on the clinician and how it's being run within a specific site. And then obviously they then will get referred to other services or discharged depending on their diagnosis. And really what will happen is in parallel to this kind of clinical pathway is the research pathway, in which following a week after their diagnosis, we will obtain informed consent and then complete a series of quantitative measures about the patient and carer satisfaction, but also complement this with information surrounding the socio-demographic factors and any kind of contextual information. We will then, after a week or so after that, we will select a subset of participants to then take part in in-depth individual interviews so that we can get more detail about why people are satisfied, what is driving their satisfaction or dissatisfaction in services. And then finally, 20 weeks after the initial diagnosis, we will be collecting from their medical records a whole set of clinical outcomes relating to their diagnosis and clinical pathways. So at this moment in time, we've just begun the recruitment in Surrey and Sussex, and we are currently in setup within SLAM, and hopefully by the end of the year, we will have an interim analysis plan derived from the quantitative and qualitative data.